This is an introduction to the next talks, and it's a result of patient survey from long COVID with Maarten van Herck from Longfonds in Netherlands and Krisnah Poinasamy from the Asthma UK and the British Lung Foundation. I hope I pronounced the names fairly okay.
I will start sharing my slides. Thank you for the introduction and thank you for the invitation to talk during this conference. The upcoming 10 minutes, I will talk about the patient surveys we did with our research group in patients with long COVID. So based upon the severity of infection, patients can be classified as either being hospitalized, and they are often called moderate to severe cases, or patients who recovered at home, and those are often referred to as mild cases. And in the beginning of the pandemic, we were mainly focused, or the world in particular was mainly focused on the hospitalized cases, although this is only a minority of the total cases who were infected. And somewhere around spring 2020, the first evidence about long-lasting symptoms in patients with COVID, and more specific in patients with who were hospitalized for their acute infection, trickled down. And a lot of us researchers were worrying about, but what about the non-hospitalized patients? Are they also suffering from the long-lasting symptoms? And is this maybe just the tip of the iceberg? And the upcoming days and weeks, more and more anecdotal evidence appeared in news outlets about long-lasting symptoms after COVID infection, and also so-called mild infections. And the amount and also the extent of online peer support groups arose from all over the world on several platforms like Twitter and Facebook. It increased enormously, and patients try to connect with each other, but also share their story and find recognition. And with some of these groups, we work together with for this research project. And I will recommend it to all researchers who are listening, because it's really important. They are the experts, so and they have the lived experience, so please include them before your study, but also during and after. And in our study, we had several aims, and the aims were to characterize long COVID on the one hand and gain insights in the impact of long COVID on quality of life, work, and functional status on the other hand. And we recruited patients via online patient support groups in Belgium and also in the Netherlands. And therefore, we do have indeed a selection bias, but although we could answer our research questions. And the study was twofold. So we had a two-way follow-up survey. And the first survey was released in the beginning of June. And people who responded to the first survey also were contacted for a follow-up survey 3 months later. And in total, about 2,000 respondents answered the survey, and the majority of them were non-hospitalized patients. And only a minority of the non-hospitalized patients received indeed a diagnosis via nose swab or a scan. And the majority actually had a formal diagnosis based on symptoms by a medical doctor, or just on self-report they suspected to have COVID-19. And if we take a look at the clinical characteristics of these patients, you can see that they were relatively young, a mean age of 47 years old. They had 60% of them had no illness before infection, and the majority, 85% of them, reported a good self-reported health before infection. And if you look at the symptoms they reported during the acute infection, you can see there is an extensive list of symptoms. And also, the list was not long enough. A lot of people reported other symptoms, and this highlights a heterogeneous presentation of COVID-19, and that the symptoms can vary a lot from patient to patient, as already Betty told us. And if you compare the data from the acute infection with the data from the first survey and also the second survey, you can see that the prevalence of symptoms really decreased. So the length of the bars are in gray and blue are really lower than in comparison to the orange ones. But there isn't that much change between the blue and the gray ones, so little improvement. in symptom prevalence was found over time in this population. And if you take a look at the symptoms itself, you can see that fatigue is by far the most common symptom in patients with long COVID, and it's highly prevalent. And we assessed it with a specific fatigue questionnaire in this patient. And this fatigue questionnaire that can range, and you can see it in the right corner, from 8 points to 56 points. And the higher the score is, the more severe the level of fatigue is. And these patients with long COVID reported that approximately 3 months after infection, a score of 48. And at 6 months after infection, a score of 46 points. If you know the scale, and it's ranged from 8 to 40 to 56, you can see that the level of fatigue is really high, and there is a high level of intensity of the fatigue. And over time, we saw a little improvement upon fatigue level. But also, besides the fatigue, also other symptoms are really common, like the shortness of breath and the headache. But the symptom list is much longer as this, and it's not just limited to pulmonary related symptoms itself, but it's a multi-organ disease. So it implicates also several symptoms like muscle pain, joint pain, the dizziness, nausea, the loss of smell and taste, etc. But what you can see is that also 1 out of 3 people indicated they had other symptoms than our extensive list we put together with patients. So, and these symptoms could be like sleeping problems, brain fog, concentration problems, memory loss, but also hair loss, etc. And this indicates the heterogeneous presentation of long COVID itself, and it really can vary from patient to patient. And despite the little to no improvement in the prevalence of symptoms, a large proportion of our participants did receive some form of aftercare. And 80% of them had received healthcare from at least one medical professional at 6 months after infection for aftercare. And 2 out of 3 received at least one care from at least one allied healthcare professional, and in particular, it was mainly a physiotherapist, and in lesser extent, a psychologist or a dietitian. And only a minority was referred to a rehab program. But what about the impact of long COVID and the symptoms on quality of life? And here you see a quality of life questionnaire, and you see 5 domains: mobility, self-care, daily activities, pain and discomfort, and anxiety and depression. Well, the first thing that stood out is that the domain of self-care is only in a minority of patients impaired. And this is good news. But daily activities and pain and discomfort were highly impaired, and about half of them, about half of the patients, reported moderate to extreme problems on these domains at 6 months after infection. And remember, these people were really relatively young and had a good self-reported health status before infection. So the impact is high. But what about work? And given the relatively young age of our participants, work is really interesting. And what you can see is that about 3 months after infection, 73% of all work time was missed due to their ill health. And after 6 months, this improved, luckily, to about 50% of all work time was missed due to ill health. So there was an improvement, but if people went to work, they still suffered from a high amount of impairment while working. So their time working was less productive in comparison to normal. At last, we also asked patients about their informations and care needs. And here you see a word cloud, and the bigger the words are, or the bolder they are, the more they were indicated by the patients itself. And I highlighted some of them, like recognition and understanding, because most of them are poorly understood by medical professionals, but also employers, colleagues, and other caregivers. So for them, this was really important, but also they had lots of questions about the aftercare, how it will, how it looks like when I will get aftercare. Will it help? How long is long term, and how long will my symptoms last? And how is recovery looking like? So lots of questions that remain unanswered, and hopefully today will bring us some answers already. And with this, I will end my talk. And to conclude, so long COVID is really a heterogeneous disease, and it can vary a lot from patient to patient. It's not limited to severe COVID-19 alone, and it has a significant impact on daily life and activities, quality of life, but also work. And understanding and being understood is an important first step, but more needs to be done. And with this, I will thank you for your attention.
Thanks, Maarten. I'm just going to share my screen. Hopefully everyone can hear me. So first of all, obviously, thank you to the European Lung Foundation for inviting us to speak today. A lot of what I'll say is hopefully going to chime with what Betty and Maarten have said, but hopefully that's a good thing. It's sort of about reinforcing messages. I mean, I think one of the main learnings over the last year is just how little we knew. So Asthma UK and the British Lung Foundation actually started work on long COVID back in March 2020. So as Betty alluded to, it's actually early studies from China that was showing us that there was lasting damage to the lungs, and that made us think, okay, well, there's something here that could go beyond COVID, and would be something that us as a charity needed to work on. But at that time, all we thought was that long COVID was about breathlessness. We didn't know much more. So what we did in response was, the first thing we wanted to do was actually create a way for people with long COVID, particularly long COVID breathlessness, to communicate with us. So we created a new website called the Post-COVID Hub in early April 2020, and that reached over 100,000 people, primarily from the UK. But it's also a way of us receiving information from people with long COVID. And I think that's got to be my central message, is we really need the views of people with long COVID, because this is a new syndrome. We're not going to know exactly where to focus strengths in terms of support or research without the input from people with long COVID. And I'm going to go over some of the insights that we learnt from people over the past year. So we created that website. We've had insight from 4,000 people with long COVID breathlessness. And in addition to that, we've been working as part of FOSS COVID, which Betty mentioned, which is the largest national sort of flagship study looking into long COVID. It's focusing on 10,000 people who were hospitalized, but it's obviously connected very well with other studies that are looking at long COVID in the community. And I'll come on to this a bit later, but as part of that, we've overseen an exercise where we've tried to understand what are the priorities for future research and taking into account the views of people with long COVID. And throughout all of our work, we've been working very closely with people with long COVID. I mean, I feel like I'm pretty sure I speak to people with long COVID almost on a weekly basis. And in particular, my thanks goes out to people with long COVID as part of the long COVID support group, which has about 40,000 people, and Maarten mentioned earlier. And just as a bit of this may be stating the obvious, but this is what we were hearing back in probably about April 2020. So people who had COVID early in the year and were saying that months later, they still had breathing difficulties, aching in their limbs, and extreme exhaustion all the time. And it was then we started to understand, wait a minute, this isn't just about breathing problems. So through some of that work, so through the Post-COVID Hub, we actually started to gather information on what people were experiencing. So through the survey of about 4,000 people with long COVID, we were getting this information of the wide range of symptoms that people were experiencing. And of course, it wasn't rigorous research at that point. It wouldn't be right for us to sort of ascribe different percentages to these different symptoms, but it was more that sense of an enormous range of problems. And I put a link to some of the early findings that we had, and including a Miro board, which is basically almost a sketch of the journey of people with long COVID from their initial COVID symptom to experiencing long COVID to their attempts to reach out for healthcare. And this is another key message, I think, about long COVID. It's not simply that one has long COVID and it's a steady, I suppose, range of symptoms or debilitation. It's actually that the symptoms come and go. And this is really something quite important, I think, that quite often people with long COVID have told us that they seem to be getting better. And just when they seem to be getting better, actually then their symptoms return again. And in particular, Betty mentioned how people with long COVID, there's a kind of high prevalence of women with long COVID. She mentioned 1.5 times more than men. And it's actually women who've been telling us that some women, their symptoms fluctuate along with their menstrual cycle. And that's valuable information for us, because then that helps us understand, okay, well, if that's the case, then that might be an avenue for research. It might be something that healthcare professionals need to consider when they're thinking about people with long COVID, i.e. that it's not simply a case of a single treatment and then that's it, and someone's recovery is steady. It is not steady. And then also something that Maarten and Betty both mentioned was this impact on people's lives. I mean, to me, it's been shocking and disheartening to hear how people with long COVID have lived the past year, and a lot of the people I speak to have been out of work, and yet trying to fight for someone to be hearing them, someone to acknowledge that their experience is actually something that demands attention and demands a response. If you think back to even, I would dare say, May last year, people weren't really even talking about long COVID. We thought something was happening, but there wasn't really the research set up to look into this. But I think that touch point with employers, and I think someone in the chat also mentioned this, is something that as a society, there needs to be a recognition that long COVID is occurring. I don't know if that's, I'm speaking too slowly and someone's just moved that. This is almost reiterating this point around insights from our surveys in terms of the impact upon work. So 75% of people, and this all chimes with the two videos that were shown right at the beginning of today's conference, but the huge impact on people's work, the range of symptoms, but also the fact that a lot of people are reaching out to their healthcare system and either they're not getting any diagnosis or they are being turned away from care. And then I just wanted to talk very briefly about FOSP-COVID. So this is the major study that is looking into long COVID in hospitalized patients, 10,000 people with long COVID. And it involves a range of different working groups looking at the different symptoms of long COVID, but it also involves the charities who are bringing their insights into how people, let's say with breathlessness or with problems with their kidneys, might be supported. And so it's almost trying to not start from scratch, but what can we try and do to help people, and how can we make sure that their voices are heard within these working groups? And so as part of this work, we undertook a prioritization exercise. I won't go into all the detail, but it was about us trying to understand, okay, so what do we need to focus on? This is an urgent health issue about which we know very little. So where should we focus our efforts? And key to this was getting the views of people with long COVID. So those working groups that I had on the previous slide, they were working with people with long COVID to understand what are the right questions to be asking. And they developed 115 questions, which then were sort of reduced down to 24 overarching areas. And then we put out a survey for people with long COVID. So we reached 900 people with long COVID, both hospitalized and in the community. Again, to sort of Betty's point about it's not really wise to be distinguishing between the two. We need to try and get the views of both. And then following that survey, we then looked at 17 questions. So that's both with academics, clinicians, and people with long COVID, to then get to 10 priority questions. And those questions will be released into a publication in the next month, we hope. But for now, I just wanted to share some of the broad areas that are being discussed. So this isn't everything, but I just wanted to share, I mean, perhaps these aren't even controversial, but this is what people with long COVID and the academics agreed on where we should be trying to focus. So the causes of long COVID, outlook for health, trying to have some tests to monitor progress, and understandably treatments, because a lot of people have had long COVID for a year plus and have had nothing to help them. So there are more areas, and hopefully within the next month we'll release a publication and we'll share that with the European Lung Foundation, and hopefully we can tweet about that in due course. So finally, I just wanted to share some of the work that we've been doing to help people with long COVID. So the British Lung Foundation, we've created some support for people with breathlessness, and you'll find that at this website here, and hopefully that can be of help to people across Europe. But also in the last couple of months, we've actually developed a partnership with NHS England, our healthcare service, and we're actually partnering with charities to deliver a service for people with long COVID. And what that will entail is trying to develop a simple framework to describe people's symptoms. So one of the challenges has been, or that we've heard from people with long COVID, is they're telling everyone over and over again, I've got fatigue, I've got breathlessness, I've got muscle pain, and they don't have a sort of framework to work from to understand whether this might be long COVID or something that they can go to their healthcare professionals to have a conversation. So we're helping them with that framework to describe their symptoms. We're providing support, as I mentioned, on different symptoms. So recognizing British Lung Foundation can support with breathlessness techniques. The British Heart Foundation will support on cardiac symptoms. And hopefully this will all be in the public domain. Hopefully this will be of help to people across Europe in terms of at least seeing how we're approaching support for people with long COVID. And ultimately, we want to see better engagement with the health service, but also with employers, because I think that's a huge part of the story, as I said earlier, is that getting that recognition of long COVID is really key, so that when people are either experiencing that fluctuation of symptoms or actually having to take some time off work because they are struggling with their brain fog, that's really key, and there are services available. Just on that last slide, I just had my contact details. Like I said, the key message here is that none of this can happen without people with long COVID explaining, what their experiences are, and then that informing the support and the research that happens. So please feel free to reach out. Thank you.